Hello everyone, introduce myself. My name is Karunia Glorya Lumempow, a Diploma 3 nursing student at the Health Polytechnic of the Ministry of Health Manado. Today, I will explain the standard operating procedure for infusion. Okay, standard operating procedure for infusion. Definition: infusion installation is an action performed on patient who require fluid or drug input directly into the veins in certain amount and time using an infusion set. Destination: A. Maintain or replace body fluids, electrolytes, vitamins, protein, calories, and nitrogen. In clients who are unable to maintain rather strong input by mouth. B. Restore acid balance. C. Restore blood and volume, and D. Provide an open channel for drug administration. Indication: A. Shock patient. B. Patient experiencing excessive fluid loss. C. Severe intoxication. D. Before blood transfusion. Patient will need specific treatment for preparation tools. A. Sterile tools. Number 1. The treatment tub contains a hand scoon and sterile gauze. 2. Infusion set sterile. 3. Needle, wing needle, advocate wide, appropriated. Number 4. Quarantine and each plates. 5. Comb lid containing cotton alcohol. B. Non-sterile tools. Number 1. Standard infusion. 2. Spillance and banks in necessary. 3. Perlak and its base. 4. Barrier or tourniquet. 5. Plaster. 6. Verband cord. 7. Crooked. 8. Clean gloves. 3. Drugs. Number 1. Alcohol. Number 2. Liquid according to the doctor's advice. NaCl, dextrose. Next, implementation patient preparation. 1. Introducing yourself. 2. Tell and explain the purpose of the action. 3. Ask for the patient willingness to be treated. 4. Comfortable positioning for the client. Next, environmental preparation. Number 1. Create a quiet and safe environment. 2. Use catheters when performing procedure. 3. Bring the instrument close the patient. Next, implementation. Number 1. Washing hands. Number 2. Wearing gloves. Number 3. Opening the area where the infusion will be placed. Number 4. Install the base under the lamp to be installed infusion. Number 5. Open the infusion set and place it in the sterile instrument tub. Number 6, insert the infusion seed needle into the infusion bottle, then drain the fluid into the infusion to be ending in a pan to remove air and fill the infusion to be. Number 7, fill the infusion droplet approximately halfway. And number 8, make sure the infusion hose ruler is close toward the bottom. Number 9, hygiene the infusion to be on the infusion standard. Number 10, unwrap the bucket from the web wrapper. Number 11, cut 3 sets of plaster. Number 12, cause the blood vessel to be insulted, white and infusion. Profit that large blood vessel, not pressing blood vessel, not in joint area. 30, where the proximal upper part of the blood vessel to be infused with a tourniquet. 4, for it asks the patient to hold the hand with the patient thumb in the grip. 50, defines the area where the infusion will be inserted. 60, insert to infused needle. Implementation, patient preparation. Number 1, introducing yourself. Number 2, tell and explain the purpose of the action. Number 3, ask for the patient willingness to be treated. Comfortable positioning for the client. Next, environmental preparation. Number 1, create a quiet and safe environment. Number 2, use sketches when performing procedures. Number 3, begin the instrument close to the patient. Next, implementation. Number 1, washing hands. Number 2, wearing gloves. Number 3, opening the area where the infusion will be placed. Number 4, install the bus under the line to the install infusion. Number 5, open the infusion set and place it in the sterile instrument tub. Number 6, insert the infusion set needle into the infusion bottle, then drains the fluid into the infusion to be ending in a pan to remove air and fill the infusion to be. Number 7, fill the infusion droplet approximately halfway. Number 8, make sure the infusion of ruler is close toward the bottom. Number 8, hang the infusion to be on the infusion standard. Number 10, unwrap the bucket from the wrapper. Number 11. Cut 3 sets of plaster. Number 12. Choose a blood vessel to be installed with an infusion, provided large blood vessel, not bruising blood vessel, not in the joint area. 13. Where the proximal upper part of the blood vessel to be infused with a tourniquet. 14. Ask the patient to hold the hand with the patient thumb in the grip. 15. Disinfect the area where the infusion will be installed. 16. Insert the infusion needle into the vein with the needle hole facing up. Make sure blood flows through the needle and advocate. If it has not been drained by blood, find a vein until the blood flows through the needle and advocate. 17. Tourniquet in release it when the blood has entered. 18. Remove the needle while leaving the advocate in the vein. 19. Press the base of the advocate to prevent blood from escaping, and insert the end of the infusion set into the advocate. 20. Cross fixation using advocate plaster that has been installed. 21. Flow the fluid from the bottle into the vein by opening the ruler. When the drip is smooth, the needle enters the correct vein. 22. Fixation by means of the butterfly. Pat the plaster upside down under the infusion to be crossed, then cross it. 23. Closing the needle and the puncture set with the sterile gauze and plaster it. 24. Set or count the number of the drops. 25. Adjusting the position of the infused lime if the needs to be puffed. 26. Write the date of infusion on last plaster. 27. Tidy up equipment and patient. 28. Take off gloves and wash hands. Evaluation. A. Smooth infusion, flow and drip. B. No hematoma. C. Maintained sterility. D. Infusion neatly insulated. patient, comfortable, and last clean and a free roaming.